Hi everybody, welcome to the Rare Wellness Podcast. In this podcast, we explore cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments. I'm joined today by Becca Pomona, one of our performance medicine nurses here at the Center for Regenerative and Performance Medicine.
Hi everybody, this podcast is brought to you by the Center for Regenerative and Performance Medicine, located here in the beautiful Pacific Northwest. You can visit us online at www.c4rpm.com.
Before we begin, a quick disclaimer. This podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare provider for any medical concerns or treatment.
Okay, so let's get into it.
On today's podcast, we're diving into 5 practical steps to reduce inflammation. Whether you're preparing for a regenerative medicine procedure or you're just tired of feeling achy, groggy, or run down. Becca, before we get into the 5 strategies, let's set the stage. A lot of people hear the word inflammation and they think of a swollen ankle or a red hot joint, but the kind of inflammation we're talking about today is different. What does it actually feel like when someone is walking around with chronic low-grade inflammation?
Yeah, it's subtle, and that's what makes it so tricky. The patients we see usually describe persistent fatigue that sleep doesn't fix, brain fog, stiff and achy joints, especially in the morning, maybe bloating after meals, skin issues like eczema or rosacea, and weight gain that will not budge no matter what they try. It's this general feeling of just not being right.
Exactly. And that low-grade, smoldering inflammation is linked to almost every major chronic disease: heart disease, type 2 diabetes, Alzheimer's, autoimmune conditions, cancer. A landmark review in Natural Medicine described chronic inflammation as the most significant cause of death worldwide. So this matters. The good news is that 5 strategies we talk about today are things that you can start doing right now. And I think the number one thing is going to surprise people.
Yeah, I think so too. Most people expect diet to be number one, but you've put something else at the top of the list.
The number one on our list is sleep. And I know that might sound strange because people think about reducing inflammation by going to food or supplements, but here's why sleep is the top of our list. And it's a 2-part argument. First, the direct anti-inflammatory evidence is incredibly strong. And second, this is the part people miss. Sleep is a multiplier of everything else on the list. If you're not sleeping well, you're probably not doing the other 4 well either.
That's a really important point. Can you unpack that multiplier idea for us a little more?
Think about it this way. When you're sleep deprived, what happens to your willpower, your decision-making, your motivation? It all degrades. There's excellent research showing that sleep deprivation impairs prefrontal cortex function. That's your executive control center. And it increases activities in your amygdala, which drives impulsive, reward-seeking behavior. A study in the Journal of Natural Communication showed that just 1 night of sleep loss significantly increased the desire for high-calorie, high-sugar foods. So you can have the best diet plan in the world, but if you slept 5 hours, you're reaching for that donut instead of the salmon. Same with exercise. Are you really going to get up and train when you're exhausted? Sleep is the foundation that makes the other interventions actually stick.
And the direct research on sleep and inflammation, what does that show?
It's striking. A study in the Archives of Internal Medicine found that even 1 single night of partial sleep deprivation, 4 hours instead of 8, increased circulating levels of IL-6 and TNF-alpha the next morning. 1 night. And a meta-analysis in Biology and Psychiatry that pulled data from 72 studies found that both short sleep duration and poor sleep quality were independently associated with elevated CRP and IL-6 levels. This was dose-dependent. The worse sleep, the higher the inflammation. And it creates a vicious cycle because pro-inflammatory cytokines reduce deep, slow-wave sleep, which is the phase where your body does its most significant repair.
So you get inflamed, you sleep worse, and sleeping worse makes you more inflamed. You have to break that cycle.
Exactly. And here's the thing I want listeners to hear. Sleep is deceptively hard. There are other things on our list that have relatively crisp checklists. Swap out your cooking oils, take these 3 supplements, do this exercise routine. You can write those on a note card and follow them. But sleep? There are a million things pulling us away from it. It's the Netflix episode at 11 p.m. It's scrolling in bed. It's the work email you check at midnight. It's the kid who needs something. It's the worry that keeps your brain spinning. Getting good sleep means giving things up. And that's physiologically harder than adding something new.
And that is so true. Adding a supplement is super easy. Turning off the phone at 9 p.m. and actually going to bed, now that is a total lifestyle change.
It is. So the practical targets, 7 to 9 hours for most adults, and quality matters as much as quantity. Keep the room cool, 65 to 67 degrees, consistent sleep and wake times, even on weekends, so your circadian rhythm doesn't know it's Saturday. No screens 30 to 60 minutes before bed. And if you need support, magnesium L-threonate in the evening is one of the most effective forms of magnesium for raising your brain magnesium levels. A study in the journal Neuron showed that it enhances synaptic plasticity in animal models, and clinical data supports improved sleep quality in humans.
Okay, so number 2, and this is the one most people expect at number 1, clean up your diet.
Right, and this really has 2 moves in one. Subtract the bad and add the good. On the subtract side, the 3 big offenders are processed foods, seed oils, and added sugar. A large study in the British Medical Journal, the NutriNet Santi cohort with over 100,000 participants, found that just 10% increase in ultra-processed food consumption significantly increased cardiovascular disease. Seed oils are extremely high in omega-6 fatty acids, and the modern omega-6 to omega-3 ratio has shifted from historically a 2-to-1 to roughly 15-to-1, which promotes pro-inflammatory eicosanoids, and added sugar directly activates NF-kappa beta, the master switch for inflammatory gene expression. A study in the American Journal of Clinical Nutrition showed that 1 or 2 sugar-sweetened beverages per day significantly increases CRP and IL-6 levels in healthy adults.
So swap the seed oils for olive oil, avocado oil, or butter. Cut the processed foods and excess sugar. What should people add in?
Fatty fish like wild-caught salmon, sardines, mackerel, at least 2 to 3 servings per week, rich in EPA and DHA, the omega-3s that are precursors to specialized pro-resolving mediators that actually shut down inflammation pathways. Berries, blueberries, strawberries, blackberries, loaded with anthocyanins. Multiple meta-analyses have shown that anthocyanin-rich berry consumption significantly reduces CRP and TNF-alpha and IL-6. Leafy greens, coniferous vegetables, extra virgin olive oil, which contains oleocanthal, a compound like ibuprofen with anti-inflammatory properties, and I'd add prebiotic foods such as onions, garlics, asparagus, artichokes, and fermented foods, because feeding your gut bacteria is part of eating healthy as well.
I really love the great-grandmother test. If your great-grandmother wouldn't recognize it as food, probably leave it on the shelf.
That's a perfect rule. All right, number 3, targeted supplements. And I want to be upfront here. Supplements are an amplifier, not a replacement. They amplify what good sleep and a good diet are already doing. Without the foundation, however, it's like putting premium gas in a car with flat tires.
So what 3 supplements would you recommend?
First, a high-quality fish oil, and I recommend a high quality because a study in the Scientific Journal found that 83% of over-the-counter fish oil products were oxidized beyond acceptable limits. Oxidized fish oil can actually be pro-inflammatory. You want third-party tested, reputable manufacturer at a therapeutic dose. A meta-analysis in the Journal of Cytokine confirmed that omega-3 supplementation at adequate doses significantly reduced CRP and other inflammatory markers.
This is the myth that we hear all the time. Patients think they're taking fish oil because they bought a bottle at the grocery store, but it's 300 milligrams per capsule, 1 a day, and that is nowhere near therapeutic.
No, not even close. Second is curcumin, the active compound in turmeric. It directly inhibits NF-kappa beta. A meta-analysis in phytotherapy research across 6 randomized controlled studies showed that the curcumin supplementation significantly reduced CRP. The catch is bioavailability. Look for formulations with piperine or a phospholipid delivery system. I recommend 500 to 1,000 milligrams of bioavailable curcumin daily.
And the third is vitamin D, which surprises people because I think a lot of people think of this as just a bone vitamin.
Right. Vitamin D is actually a steroid hormone that modulates over 1,000 genes involved in immune regulation. It promotes anti-inflammatory cytokines like IL-10 while suppressing pro-inflammatory ones. A systemic review in the Journal of Nutrients confirmed that deficiency is strongly associated with elevated inflammatory markers, and supplementation reduces CRP. Here in the Pacific Northwest, almost everyone is deficient when we first see them. We target 50 to 80 nanograms per milliliter. Most people need 4 to 10,000 IUs of D3 with K2 taken with a fat-containing meal daily. This one is one of the most potent anti-inflammatory interventions we have, and the evidence is incredibly robust. A landmark meta-analysis in brain behavior and immunity that pulled data from multiple randomized controlled trials found that regular exercise significantly reduced CRP, IL-6, and TNF-alpha. And this was independent of weight loss. And that's an important distinction. Even if the scale doesn't move, the inflammation comes down.
So why does exercise reduce inflammation? Like, what is the mechanism?
There's several mechanisms. First, skeletal muscle is actually an endocrine organ. When you contract muscle, it releases anti-inflammatory signaling molecules called myokines. The most studied being IL-6 released from muscle, which paradoxically has an anti-inflammatory effect when it's released during exercise, as opposed to the pro-inflammatory IL-6 released from adipose tissue. Second, exercise improves insulin sensitivity, and insulin resistance is one of the most potent drivers of chronic inflammation. A study in diabetes care showed that resistance training alone significantly improved insulin sensitivity independent of weight change. And third, exercise reduces visceral fat, the metabolically active belly fat that pumps out inflammatory cytokines around the clock.
So what does the prescription look like? How much exercise are we actually talking about?
The research supports at least 150 minutes per week of moderate intensity activity. There's something that gets your heart up and makes conversation a little hard. Walking briskly, cycling, swimming, but I want to emphasize that resistance training is not optional. It's arguably the most important modality for inflammation because of its effects on insulin sensitivity and muscle mass. 2 to 3 sessions per week of strength training, and here's the nuance. More is not always better. Overtraining can actually increase inflammation. A review in the Journal of Sport and Health Sciences confirmed that moderate, consistent exercise is anti-inflammatory, while exercise training without adequate recovery promotes inflammation. So consistency at the right intensity beats intensity without consistency.
Now, that's a really great message. You don't have to crush yourself in the gym. You just need to really show up regularly.
All right, number 5. And this one is the more cutting edge option. Microdose GLP-1 receptor agonists. You've probably heard of semaglutide or tirzepatide, Ozempic, Wegovy, Mounjaro, originally developed for diabetes and weight loss. But what's increasingly clear is that these medications have a direct anti-inflammatory effect independent of weight loss.
You say independent of weight loss. That's the key point, right?
Right. The SELECT trial published in the New England Journal of Medicine, over 17,000 participants with cardiovascular disease but without diabetes, showed that semaglutide reduced major adverse cardiovascular events by 20%. The investigators found that a 38% reduction in CRP that preceded and was disproportionate to the weight loss. This suggests a direct anti-inflammatory action of GLP-1 receptors in immune cells. And a review in cardiovascular diabetes confirmed the mechanism. GLP-1 receptor activation reduces macrophage infiltration, inhibits NF-kappa beta and immune cells, and decreases oxidative stress.
And microdose means much lower than the typical weight loss doses?
Correct. When we're using these for anti-inflammatory and metabolic benefit, the dose is much lower than standard protocols. The goal isn't appetite suppression, it's metabolic optimization. This is a conversation to have with your provider after you've been consistent with the first 4 strategies.
So how should people approach this list? All at once or one at a time?
Start with number 1, fix your sleep. I know that sounds simple, but as we discussed, it's deceptively hard and it's foundational to everything else that it's built on. While you're working on your sleep, clean up your diet. Those two are synergistic. Better sleep improves your food choices. Better food improves your sleep quality. Give that 4 to 6 weeks. Then layer in supplements and start an exercise routine. After 2 to 3 months of doing that consistently, if you're still symptomatic, that's when you talk to your doctor about options like microdose GLP-1s.
And if someone is doing all the right things and they're still not getting or feeling any better, what labs might they ask their doctor to check?
Good question. Ask for a high sensitivity CRP or C-reactive protein, your best general inflammatory marker. You can also look at fasting insulin or peptide C, hemoglobin A1C to assess metabolic inflammation, a vitamin D level to confirm that you're in the optimum range, and a comprehensive metabolic panel. Those tests will tell you a lot about what's going on and help guide the next steps. Becca, this has been a great conversation. Let me wrap up with the 5 takeaways. Number 1, and the most important, prioritize your sleep. 7 to 9 hours of quality sleep is foundational and makes everything else work, even though it's the hardest one to get right. Number 2, clean up your diet by removing processed foods, seed oils, and added sugar, and adding in fatty fish, berries, colorful vegetables. And number 3, add targeted supplements, high-quality fish oil, bioavailable curcumin, and optimize your vitamin D levels. Number 4, exercise consistently with both cardio and resistance training. And number 5, for persistent inflammation, talk to your doctor about microdosing GLP-1 receptor agonists. But start with sleep and layer on the rest.
Thanks for joining us today, everybody. If you found value in today's episode or you learned something new, please leave us a review, subscribe, or share this podcast with a friend. Your support helps us to provide free content to support you on your journey to better health.
And I'm Dr. Jamie Lewis, reminding you your body holds an incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock its full potential and help you live your best life now. We'll see you next time.
See you next time.